Okay, good evening, members, officers, and welcome to this evening's Social Services Scrutiny Committee meeting on the 23rd of November 2021. Oh, bear with me. People waiting in the lobby. This meeting will be recorded and made available to view via the Council's website, except for discussions involving confidential or exempt items. Therefore, the images, audio of these individuals speaking will be publicly available to all via the recording on the Council website at www.caerphilly.gov.uk. Agenda item 1 is to receive apologies for absence. Can I ask the scrutiny officer, please, if there is any apologies for absence?
Yes, Chair. We've had apologies from Councillor Donna Cushin, from Councillor Gale, and also from Michelle Jones.
Okay, thank you. Item 2 on the agenda is...
Excuse me, Chair. I spoke to Councillor Charlotte Bishop. I understand she extended her apologies for this evening, so could she be included?
Absolutely.
That's noted, Chair.
Okay, item 2 on the agenda is declarations of interest. Councillors and officers are reminded of their personal responsibility to declare any declarations of interest in respect of any item of business on this agenda in accordance with the Local Government Act 2000, the Council Constitution and the Code of Conduct for both councillors and officers. Are there any declarations of interest this evening? No?
Yes, Chair. Just to declare an interest, as I work as a senior manager within adult services in another authority.
Okay. Mark, do we need some advice on that?
Yeah, that's noted, Chair. That's fine. That's not a prejudicial interest, as it's with a neighbouring authority, and the report which Councillor James, I think, is referring to relates specifically to charges for this authority. Thank you, Chair.
Okay. Item 3 on the agenda is to approve and sign the following minutes of the Social Services Scrutiny Committee held on the 1st of November 2021. So just going to go through checking for accuracy now. So on page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8. Is there any points of accuracy? Anyone that's got any points? If not, can I ask somebody please to move the recommendation?
I'll move the recommendation, Chair.
I'll second, Chair.
Thank you. Okay, so members are asked to vote on the recommendation by assessing the forms ballot, which will now appear on your screens. Then click on either for, against or abstain, and then finally click on submit vote. Mine's not coming up. Everyone okay with the vote?
Chair, it hasn't come up on my screen either, but I'm for.
So, yeah, that's been carried unanimously, Chair. There's 7 votes for, no votes against and no abstentions. If there's anyone who's struggling to vote, I can take their vote verbally if you'd like. So that's, I think, a 4 from Councillor Jeremiah, wasn't it?
I don't think there's anyone else.
Yes.
Okay, thank you for that. So item 4 is consideration of any matter referred to this committee in accordance with the call-in procedure. Can I just check with the scrutiny officer, please? Have we had any call-ins?
No, Chair, nothing's been called in for this meeting.
Whizzing through this agenda. Item 5 now is the Social Services Scrutiny Committee Forward Work Programme. I'd like to hand over now to the Scrutiny Officer.
Thank you, Chair. Members are asked to consider the Forward Work Programme for this committee alongside the Cabinet Work Programme as appended to the report and to suggest any changes. Just a note for the diaries, the next meeting of this committee is on the 25th of January. And we have one item so far on the agenda for that meeting, and that's the Period 7 Budget Report for 2021-22. So if members are happy, I would like to seek approval to publish the Social Services Scrutiny Committee Forward Work Programme as appended to the report onto the Council's website. Thank you, Chair.
Thank you. Okay, can I have somebody to move the recommendation?
I move, Chair.
Sorry, who was that?
Councillor Walter Williams.
Thank you, Walter. Have we got a seconder, please?
I'll second that.
Sorry, who was seconding?
Councillor James, I believe, Chair.
Okay, thank you, Councillor James. Okay, so we're now going to vote on this recommendation by accessing the forms ballot, which should now appear on your screens. Please click on against or abstain or for, and then finally click on the submit button.
Everybody vote, yeah.
I'm getting my screen is stuck on the forms.
I can take verbal votes after I read out the result from those who've managed to vote via Microsoft Forms, if you like, Chair.
Thank you.
Yeah, so we've got 6 votes for, no abstentions and no votes against so far. I don't know if anyone's had difficulty voting via forms.
I've had difficulty, so can you put me down for 4, please?
Yes,
Yeah.
Chair.
Councillor Jeremiah as well. I'm for.
Okay, thank you both.
Thank you.
So that's
Okay.
8 votes for. Thank you, Chair.
Thank you. So item 6 is to receive and consider the following cabinet reports: the Local Housing Strategy 2021 to 2026.
Yes, that hasn't been brought forward for this meeting, Chair.
Okay, so will this be brought forward to another meeting in the future?
No, Chair. It's a report that's already been to Cabinet, and members have been given a deadline. I think it was up until yesterday morning to bring this forward for discussion, if they wanted to. And no member has brought this forward for discussion tonight.
Okay, thank you.
Thank you, Chair.
So item 7 is a presentation this evening from an Iron Bevan University Health Board. So they're going to give us a presentation, and we have Nicola Proskowski, the Director of Planning, Digital and IT. I hope I said that right, Nicola. Nicola Wood, who's the Director of Primary, Community and Mental Health, and Leanne Watkins, who's the Interim Director of Operations. I'll hand over to Nicola, please.
Yeah, thanks, Councillor Brzezina. So thank you. It's Nicola Bragodic. It's not an easy name to say. It's I've heard many forms. I just wanted to add that I've also got Andy Bagwell on the call, who's a senior clinical lead in our organisation, also an anaesthetist, but has been is very active in our kind of planning and operational delivery at a senior level. So thank you for inviting us. It's really good to be with, to have the opportunity to talk to you today. And the brief we got from Mark was to concentrate on the kind of Grange University Hospital, and particularly around the emergency department and minor injury units. So that's what we wanted to spend our time on. What I was going to propose is we shared a shortish presentation with you yesterday evening. Hopefully you've had that. So I'll run through the presentation. And then I'll ask my colleagues to add in anything that I might have missed or they feel is pertinent to add, and then hopefully leave plenty of time for questions and comments on that by members, if that's okay. And apparently Alistair Richards is going to possibly join us from emergency medicine as well, who works at the Grange University Hospital. Thanks, Leah. So is that okay if I share my screen? I might not be able to see hands during that point, but if I just run through the presentation and hopefully save the questions for later, if that's okay.
Sounds great.
Thank you. Okay. So, just confirm that you can see the screen. Yeah, it's gone on to. Is that better? Yeah. Can everyone see that? Yeah. It's going to just give me an okay.
That's fine for me, Nick. Yeah.
Okay, great. Thank you. Okay, so so in terms of, as I just mentioned, the scope of today's update is just over 12 months since we opened the Grange University Hospital. As you know, we opened it 4 months early. It was a very important and difficult decision for us in terms of whether or not we were going to try and open, but it was very much a clinically led decision in terms of what we felt were the benefits of opening in advance of last winter in our response to the pandemic. So what I plan to do through the update is provide a high-level overview of what we think have been the key successes and achievements since we've opened, but also the key challenges that we have faced and continue to face. Then, as I mentioned, a focus on our emergency department and minor injury units. And I thought it was also appropriate to give you a brief update on some of the developments at Ysbyty Ystrad Fawr as well, given it's your local general hospital as well. So I thought it was just important to remind us of our current context, really, as a health board and as a health system. We very much are still dealing with the challenges of a worldwide pandemic. We've been through different phases of COVID-19, as we all know, and it's affected all of us personally and professionally in some way or another. And, you know, having to constantly adjust and respond to healthcare as we've gone through those phases has been hugely challenging. And I think, you know, whilst it's great news with our vaccination programme and we're now in a position where we are living life a little bit more normally than we were this time last year and before that, what we have seen is then the consequences of a post-lockdown impact and how that's affected our demand on NHS and acuity across the system. So we have seen increased demand. It started rising probably from about January, February last year, and every month we kept seeing an ongoing growth because, as we know, we've seen a reduction in demand for health services during the first phase of the pandemic. But it was quite clear after the second wave, and as we came out of that, demand kept rising. And what we were seeing, and people like Andy and that can vouch for this, is people were probably presenting later than normal because either they were worried about coming to hospital or because they were less active at home. The problem wasn't presenting in the same way. So by the time they did come to hospital, we were seeing a greater acuity in people's condition. The workforce challenge has been relentless, really, because as it affects us in our personal lives, it affects our staff. So staff who've been shielding or have been have also contracted COVID or have been isolating in line with the rules has meant that we've constantly been at around at least 8% absence, if not higher, and affecting many of our frontline services that are critical to delivering care. And it's not just about workforce in health. As we know, the workforce challenges in social care and in other parts of the system has been significant, and their challenges then back up into the health system. And even places like WAST, lots of the problems we get on ambulances is their ability to staff their normal fleet to respond to demand in the community. We're still dealing with variation in COVID numbers. We track these every day in terms of our hospital cases, our suspected, our recovering COVID patients. And, we've constantly had COVID patients in hospital. We have in the last 2 to 3 weeks started seeing this come down from about 100 we reached a couple of weeks ago. We're down to about 50 today. But we are constantly having to respond to those different, that kind of variation in presentation and adjusting our capacity into what what we call red capacity if they're COVID positive, into amber where they suspect where they're not COVID positive, and green, which is more elective. So trying to adapt our hospitals and our capacity into these different pathways is extremely challenging. And we've also seen increase in length of stay. So lots of our patients who are coming in with COVID or with other problems, we're seeing that increased length of stay in our hospitals as well. The social care challenges I briefly mentioned, huge challenges in capacity and workforce for social care, and we've been working with our local authority partners in terms of how can we work together through some of our civil contingency and emergency planning measures to try to work together on more innovative solutions, particularly around workforce. I think we're in a different phase now. We've got significant backlogs. You know, it really is devastating for us. Just before the pandemic hit, we had about 800 to 900 people waiting more than 36 weeks for elective surgery. Generally, we were hoping to get to zero. We've now got over 36,000 people when we reported in October waiting more than 36 weeks. Lots of those are at the outpatient stage, but you know, we are now trying to make sure we can, you know, and people's expectations have changed, rightly so. They've waited long enough. They want to be able to be seen, and we are trying to recover those positions at a time where we are still trying to respond to the COVID demands. I think we've all seen a change in public expectation, you know, and the media attention we've had in Gwent, because opening a new hospital in the middle of a pandemic has been very helpful in some ways, but it's also wrapped up in opening a new hospital, and the Grange has had a lot of bad press. For some, you know, understandably long waits, but we are actually not an outlier compared to the rest of Wales and the rest of the UK, but have attracted more attention as a result of opening a new system and a new model of care. And I think we've got a challenging winter ahead. We're trying to keep our staff optimistic and positive in amongst some very gloomy headlines around it going to be our worst winter ever, with the ongoing demands of COVID, flu and respiratory viruses for children, which we've seen in some of our Southern Hemisphere's countries. So we're preparing for that as well. And just to finish kind of this context, I know this is a busy slide, and please look at this at your own, but just to pull out a couple of key points. Pre-pandemic, we expected to see around 250 to 500 people come into our front doors, as in the ED at the Grange or our minor injury units. And over the last 6 months, we've seen those numbers range from 368 to a peak of 702 attendances per day. You know, a huge increase, and we weren't coping before in our unit, in our A&E departments, as you know. So to be trying to manage these numbers across the system has been a huge challenge for us. And some of those variations, as I mentioned, in the peaks, those days where you get those really high peaks, are hugely challenging for us. And I think linked to that is the number of people who are self-presenting. And again, as I mentioned to you, pre-pandemic, we expected around 300 to 450 a day to be people who would self-present. Ambulances are a smallish proportion of who come to our A&E departments and our ED at the Grange, but we have seen 500 regularly attending daily, and you can see the ranges there. And again, the Grange has taken the biggest brunt of that, between an average around 220 a day presenting, where we were predicting between 100 and 167. Some of that was because of some of the pressures on ambulance, and people will end up not waiting and they'll get in the car and go to the Grange themselves, which, you know, all of us will do the same often if we're in that position. But that takes away our opportunity to possibly direct people to the right place. So this is just a little bit of context of what we're working in. So just reminding us of the new model. As you know, when we opened the Grange, we consulted on this many, many years ago, and had constantly been sharing our plans with the public pre-pandemic, and we're kind of lining up for this to be put in place in March 21. But what we did do is centralise our Pediatric, Obstetrics and Neonatal department. This was particularly a service that was struggling to keep running over 2 sites because of the workforce challenges, particularly our medical staff. And a number of times we thought we might have had to have centralised at the Royal Gwent because of that sustainability issue. Our ED majors, our medical assessment unit, surgical assessment unit are now at the Grange. Our critical care department, that was 25 beds split across Neville Hall and the Royal Gwent, is now there's a 30-bedded facility, which we currently run in 24 beds continuously from there. And our acute medicine, cardiology, stroke, respiratory, gastro, haematology are some of the specialist services which are now centralised and are much more sustainable, where our expertise are centralised in one place to enable us to meet the demands of our population much better. Emergency and surgery and trauma are centralised at the Grange, and we've got significant investment in specialist diagnostics, logistically optimally placed alongside our ED, and has given us an expansion in diagnostics across the system. And then our enhanced local general hospital, and Ysbyty Ystrad Fawr very much was our kind of pathfinder in effect, because the Royal Gwent and Neville Hall are expected to run as YWF has been running for some time, and that will include a nurse-led minor injuries unit, a medical admissions unit for people who have got a lower acuity, elderly frail assessment units. We have recently put in urgent primary care to Neville Hall and Royal Gwent last year when we opened the Grange, and we are now looking at that in YWF, which Nick can update later. We will have diagnostics continuing. We've not taken down diagnostics at the enhanced local general hospitals, outpatients, medical inpatient beds and elective surgical care, which varies across each site. And what we've tried to do at each site as well, each one will have something that's quite unique to itself. So the Royal Gwent is very much our main elective surgical centre. YWF is planning to have its breast unit and does a lot of specialist foot and ankle work. And Neville Hall will be where there's a new radiotherapy cancer centre and a lot of day surgery work happening there as well. So that was the model that we were working with the public on, and we've done quite a lot of work to try to inform the public, because we were very conscious that how do we make sure people know how to navigate their way around this new hospital model, and how will they know when to go to the Grange, when to go to your local minor injuries or local general hospital, and when to access primary care and so on. So we were very much in our planning trying to encourage people to contact 111 first if they were unsure of where to go. There's obviously some situations which are kind of fairly obvious. You need to go to the Grange where you've got any chest pain, you know, stroke, urgent surgery, all those type of things. But where you were more of a minor illness, minor injury, that you would then go to the local general hospitals. But we wanted to help the public navigate their way through this system. And we did a lot of work on our communications, and many of you will know we did publish this leaflet, which we did a household drop to every house in Gwent, in addition to, you know, extensive social media communication. We did increase our social media base by tens of thousands during the pandemic, so we had a much bigger kind of communication base with which to try to get out to the public. But I think it's only when you're faced with that situation yourself do you often pick up the leaflet and think about where you need to go. And I think if in doubt, and if you can't get through to 111, which some of you will have experienced, or you can't get through to your GP, people will inevitably turn up to the Grange or one of the enhanced local general hospitals. I think one of our biggest concerns as a health board was having people turn up to the enhanced local general hospitals that were very sick, and we invested quite significantly in additional transport with our WAST colleagues, so that we had an ability to respond within an hour and get patients transferred from Neville Hall and the Royal Gwent that were changing in particular to the Grange. And we were learning from how things worked at YWF quite a lot in terms of that. The numbers that are presented inappropriately haven't been to the level with which we planned for, albeit there have been examples where maybe the transport hasn't been as quick as we want, and we are continuously reviewing and learning from that. But what we do notice is lots of people were turning up to the Grange University Hospital who didn't need to be there and could be managed in a minor injury unit. And we've been trying to work with, again, the public and with our flow centre. We've got a flow centre which tries to direct people and the ambulances in particular, and also try to work with 111 to increase their response times, so that we can take that opportunity to direct people to the right place who sometimes, you know, are confused about where to go for which particular condition. So I think in terms of some of the key successes, our paediatric, obstetrics and neonatal unit since we've opened is without a doubt now sustainable. We became even more fragile during the pandemic. We were relying on lots of locums, lots of those ended up shielding, so we had less workforce. We've seen a reduction in our paediatric presentations during the first wave, but the view from our clinical leaders in those services is that without opening the hospital last winter, we might not have been able to have provided a comprehensive service for paediatrics and maternity in Gwent. So that was a significant driver for our decision to go early. A large centralised critical care unit for our COVID response. We were 3 to 4 weeks away from our peak last winter, and I know our critical care unit being able to stay within their own unit and not overspilling in recovery areas or makeshift intensive care units with all the staff together to give them more resilience has been a significant gain for us during the pandemic last year. Our single room provision, having a hospital with 75% single rooms, has really helped our ability to manage COVID transmission in hospital. It's very difficult to do that in open bays. And what also happened is because we then had additional space in the Royal Gwent and Neville Hall in terms of some empty wards, it enabled us to manage patients flexibly and outbreaks flexibly and have better control over our infection prevention and control measures. Our additional ED majors and resus capacity, so additional trolley space, and we used to have 4 resuscitation trolleys in the Gwent and 2 at Neville Hall, so we used to have 6, which were often compromised. We've now got 9 because we had 8 in our main ED, and we've got 1 COVID resus, which is 9, so it's a 50% increase, and we have on many days been struggling with that capacity being full. So without that additional space that we've had through the Grange opening, we really would have been in a compromised position over the last 12 months. As I mentioned, we put in urgent primary care centres at Neville Hall and Royal Gwent. This again was to try to take pressure off the hospital service where patients were turning up who could be appropriately seen in primary care, and we're still working on how we optimise that service going forward. Improved access to diagnostics across the system. There was about 12 new pieces of kit in the Grange, and we didn't take any of the others down, invested significantly in radiology, and that's enabled us to not only meet the needs in the Grange, but it's enabled us to continue to keep on top of our diagnostic demand across the system. And I think across Wales, if you look per head of population, we've got the lowest diagnostic weights. None of them are good, but we've got the least worst diagnostic weights, and some of that will be because of the capacity that we've managed to gain. There's improved access to emergency surgery. Andy would be in a much better position to give you examples of this, but patients who are, kind of really sick, which is what the hospital's designed for, their ability to get to surgery quickly, and our CPOD theatres in the Grange are much more effective than how they were working in our old system. Access to cardiology, we got 2 brand new state-of-the-art cath labs in the Grange, and we have been, been using that capacity, and in some cases avoiding transfer to Cardiff with the facilities we've now got. More recently, where we've been trying to restart our elective surgery, which we've been primarily doing at the Royal Gwent and day surgery at YWF and Neville Hall, we have managed to keep that. There is no doubt if elective surgery was at the Grange, we would have been cancelling most of that routine surgery. But because it's separated from emergencies, which again was one of our strong case for change, we are managing to do quite a lot of elective surgery. I think there's about 900 cases a week between day surgery and inpatients. And again, we've got the lowest number of 36-week waits, even though they're horrendous at 36,000. If you look at the numbers by the other health boards and look at the size of the population, we're in a better position than others. And there's no doubt our hospital model supporting us do that. And as we've obviously got some state-of-the-art facilities and equipment to deliver care. So that's what's gone well. I think that's what we look back at. One of the key reasons for opening early in particular has delivered what we hoped it would deliver. But we have got significant challenges across the system and at the hospital, as you will be aware. So we couldn't open the hospital completely as it was planned. We had to reconfigure some of our space to create 2 emergency departments and assessment areas. So we turned one of our wards into the COVID ED and assessment area. which obviously took up some of our capacity. And we've got to introduce the COVID protocols and the pathway, so all patients need to be tested, and we need to make sure that the amber red pathways can be run in the hospital. I mentioned the increased demand and the volume and acuity for urgent care, so that's had a huge impact on our emergency department at the Grange, with huge numbers of self-presenters, and our waiting room is just wasn't designed for that number of self-presenters, and especially wasn't designed for that number of people presenting when we were trying to maintain social distancing. So the waiting room has been a huge problem for us, and the ability for the emergency department team to be able to kind of monitor patients and make sure that they risk assess and bring patients in the right order. And some of that is because the amount of people self-presenting are often then of higher priority than those that present in the ambulance, and the emergency teams are continuously risk assessing those patients who need to be brought into the emergency department first, which often has caused some longer ambulance delays than we would like. But it's all part of this kind of complex presentation. As I mentioned, we have had people inappropriately presenting at the Grange. Some of that is because access to other parts of the system, or people's not being really clear about where to go for what, which is what we're continuing to work on. And we haven't been brutal in terms of turning people away immediately. We've done what we can in terms of, asking people to go to other communicating waits in other parts of the system, but it's very difficult when it's a very busy department. Primary care has been a huge focus as well. They've had to adapt really quickly to the pandemic, and we have seen more recently increases of around 20% on our primary care service as well, that are trying to manage that in amongst a blended approach of face-to-face and continued telephone consultations. Long ambulance waits has been a particular focus at the Grange. I think it's enhanced even more because it's a large centralised department. Many days it is the busier, it receives the most ambulances of any other hospital in Wales, some days even more than UHW and Morriston. And I think because it's a bigger department, you might have had 4 ambulances outside the Gwent and 4 outside Neville Hall. You've now got 8 outside the Grange. So it just gives greater profile. And, we know that this is a significant concern, not just for the people on the ambulances outside, but for the people in the community who are waiting for an ambulance. And we're working closely with our WASC colleagues and in making sure that we got the flow through the hospital. Because, as I mentioned, social care, if you've got a blockage in terms of getting people out at the end, at the back end of the system, then that just backs and all the risk sits in the emergency department and then in the community with people waiting. So we are working right across the system to improve that. I make no excuse for the ambulance waits, but when you look back to this time last year, it is similar levels. In October, the patients waited more than 1 hour was similar to what we had before we opened the Grange. And actually, we are the only health board, when you compare October to October, that hasn't seen a deterioration in its ambulance waits. None of them are good. The position across Wales is pretty dire, but you could argue it's helped us hold a position, which is not a good one, rather than deteriorate by some health boards by 200 to 300%. Workforce shortages across the system, I mentioned that already. Health board, WASH, social care, it is a constant battle. I know Alistair and others and Leanne will share that there's often days where we've got more agency nurses in some of our departments and we've got our own substantive staff. Is a constant challenge, and something we continually working with and trying to invest in our staff and their well-being, to make sure we look after them as we kind of go through the winter and beyond. We've had, as much as the pandemic is the significant driver for most of this, we have had to learn and adapt a new model of care for many specialties, and we continue to learn and adapt as we kind of continue to run this new system. And I think patient experience was significantly affected, right at the beginning with the visiting constraints. We had a new hospital, new contact numbers, people trying to get hold of their loved ones. The mobile signal in the hospital, we had full Wi-Fi from day one, but we didn't have a full 4G signal. It is now fully operational, but that didn't help at times of visiting and people trying to get hold. And we have feedback around food, and those type of issues, which we're constantly trying to listen and learn and adapt. So some specific urgent care issues for the Caerphilly population. Again, we've had quite a number of queries come about accessing UHW and Prince Charles Hospital. We have got well-established contracts in place with Cardiff and Vale Health Board and Cwmtaf Health Board for patients, particularly Caerphilly actually, in terms of North Caerphilly going to Prince Charles Hospital and South Caerphilly going to UHW. They are still in place, and actually we've been pushing quite hard to make sure that patients can access those hospitals where appropriate and where that is their nearest hospital. And we have had some examples where there's been some pushback, but we've been working with those local health boards to make sure that the contracts, we give Prince Charles around 20 odd million a year for our Gwent population to access their services, and we've been keeping an eye on that to make sure, probably places more like Tredegar are not seeing an increase, but the ambulance conveyances in particular have shown a slight reduction in conveyances to Prince Charles, but UHW, particularly in the last few months, we've seen an increase in the number of ambulances going to UHW for our population, which hopefully has addressed some of the exceptions we've had where patients have been told they can't go there. And then some specific developments at Ysbyty Ystrad Fawr. It is one of the hospitals that's probably working the most effectively as an enhanced local general hospital, and that's probably because it's been in place for some time. It's got a very good assessed out rate in terms of how they manage patients who go there as under the medical assessment unit, and we are now creating additional assessment space in that medical assessment unit to be able to meet more demand in that hospital. Some more increased ambulatory care model, and also, as I mentioned, we're looking to put an urgent primary care centre there as well, which we can build on. Public transport has been a particular issue, I think, for the Caerphilly population in terms of where this is placed in terms of the Grange. And whilst we continue to work with our private providers around public transport, it's been even more hindered, I think, as a result of the pandemic. But we have been doing work across all the boroughs around strengthened community transport, and I know there's a particular project which is the Caerphilly Parish Trust, which is being given a grant as well now to establish a more robust community transport service. But it is an area we're keen to work with the local authorities on, and some of those providers, in terms of how do we make sure we meet people's needs in the areas where it's harder to get to on public transport. So finally, in terms of our future plans and next steps for urgent care in particular, we've got a very comprehensive winter plan that focuses on all parts of the system, and we are very much working with yourselves and other partners in social care. There's a big focus on prevention and population health, and get the public to take responsibility where they can in terms of their flu vaccinations, looking after themselves, keeping well. Primary care in terms of some targeted areas to improve access, and as I mentioned, urgent primary care as well. Our enhanced local general hospitals, how do we make sure we get appropriate referrals, an integrated front door, so working with GP out of hours and the assessment units and the minor injuries, and better discharge planning, again working with our social care partners. At the Grange, big focus on hospital flow, making sure we get patients moved out of the emergency department quickly and effectively where appropriate. How do we reduce those ambulance handovers? And we've got plans in place for the same day emergency care. So we are developing a new ambulatory care area in the Grange. It won't be ready till next year, but we think will be will have a huge benefit on how we manage some people who can be where we can avoid admission. Quite a proactive communication plan where we're working with the public and our partners around trying to inform and continue to try to advise the public about where to go for what treatment. And we've also linked that up with recruitment, and you might have seen our bus we've kind of commissioned a double-decker bus over the next 6 months, and we're trying to get out and about in the communities to see if there's recruitment opportunities, and also take the opportunity to communicate with the public and receive their feedback. And that's been working really well over the last 2 weeks since we've started it. And a big focus on our workforce in terms of continued recruitment. How do we retain our staff and look after them after being what's a hugely challenging 18 months and what's likely to be a very challenging 6 months and beyond. So I'm going to pause at that point. I know I've run through that quite quickly, but I thought it was useful to set the context of where we are, and happy to take questions. I want to check first if any of my colleagues want to add anything in particular to what I've said before I hand over to questions, if that's okay. So I don't know if Nick, Leanne, Andy or Alistair want to add or just take questions.
I think the questions will frame it, Nick.
Okay. Okay, thank you. So is this okay? I'll hand over to you, Chair.
Thank you, Nicola. I know that everybody is working so hard throughout this pandemic, and I think, you know, we have a duty as well as members to ensure that we signpost as much as we can in our communities about contacting 111 before, you know, getting down to the hospitals. I think we've all got a part to play there. So really good presentation. There's obviously things that we're coming up to the winter pressures. What's your view before I get other people with their questions? How much capacity have we actually got between now and April? Given that we've got the situation with COVID, what is the capacity going to be? You know, we're already stretched now. So what do you see? Because obviously other health boards are struggling massively as well. And obviously we don't want to be turning anybody away. But, you know, what's your views on the capacity where it's going to get to a stage where you're going to have to say enough's enough, we need more support, we need more resources?
Nick, do you want to come in on that?
Yeah, so I think it's an interesting question. I think we're at peak capacity now. Mm-hmm. So we've currently got over 1,700 beds open in the health board. If you like, our funded beds, which is often what we talk about, is probably 200 or so less than that number. So we've escalated and opened all of the capacity that we've got available, and that we can staff. Some of it we are staffing on the edge, if I'm being brutally honest. I think perhaps an interesting fact that you might want to consider is that we've got over 500 patients who've been with us for more than 21 days, which is around about 150 to 200 more than we would normally expect at this time of the year. And in effect, they are sat in our escalated capacity. Mm-hmm. So in order to manage what we know is the traditional peak post Christmas, or the 27th onwards, we need to have those 200 beds available. Otherwise, the system will grind to a halt. Mm-hmm. So I think, you know, we're building capacity in terms of additional sessions in primary care, additional workforce that we can get, you know, in ED, and Alistair and his team work, you know, 24/7. We've got every available nurse available. We've got district nursing teams that are running at absolute maximum. So I think we're at peak capacity. We're where we would expect to be in the worst week of January, and this is normally a time of year where we build a bit of a buffer into the system.
Thank you for that, Nick. And obviously it's still a roller coaster, and we need to ensure that, you know, where possible, you know, staff get the maximum support around their mental health and their physical health needs. Okay, I'm going to open it up now to members. First one is for Councillor Skivins. Would you like to come in?
Yeah, thank you, Chair. If I can just raise a couple of things, but before that, I'd just like to thank you for the presentation, and also to add that on both a personal and a professional basis, I recognise, you know, the amount of effort that has been put in through the COVID situation, which is still with us and still developing, and, you know, recognise the tremendous hard work that has been put in by staff and managers during that period. So just like to say that. If I could just raise a couple of things. One's an observation in relation to the staffing issue. I used to run a recruitment company, and you know, one thing that we found quite interesting was a lot of staff which were undertaking roles as carers or nursing we're usually citing the pay levels and the degree of flexibility that the agency work offered them, you know, and I'm just feeding that in as fundamental issues there. In relation to transport, I was pleased in the presentation this issue was raised, particularly for the Caerphilly area. It has been a protracted issue, and the previous Chief Executive Officer had promised that this would be an area that would be looked at when the decision was made to change the default hospital for my area from the Heath to the Royal Gwent, where we had huge issues with transportation, and they have now been compounded with the move to the Grange. Perhaps more interestingly, we've looked at the levels of car ownership, particularly in some areas with socio-economic issues, and we're seeing quite a decrease in car ownership. So this is a matter that actually is deteriorating rather than improving. And the last thing I was going to mention, which is an ongoing issue, is the closure of surgeries. In my local ward, the surgery closed some time ago and nothing has replaced it. And in my neighbouring wards, some of the surgeries appear to be oversubscribed. So as a primary sort of facility for the first point of contact, these are reducing rather than increasing. So I think people are defaulting to primary care establishments rather than go into their local surgery. That's me, Chair. Thank you.
Okay.
Thank you. Nicola, do you want to wait until all members ask questions and then come back towards the end, or anybody else?
Well, we can pick them up as we go along if you like. So
yeah, that's fine.
So if I briefly cover the transport, and then Nick can comment on any point on the primary care. So as I mentioned, it is a kind of key priority, particularly Caerphilly and the Blaenau Gwent areas where the public transport was not quite as easily accessible to get to the Grange. There is improved transport to the Grange, but you've got to get to Newport or Cwmbran really to be able to access that. So as we've said, it's quite difficult to influence a private provider to put on a bus route, from ourselves alone. So it's not easy. But what we are hoping is the community transport provision that is put on is kind of monitor that the use and the access of that. It's important people know about it, and it'd be useful to see how people access that, to see if that's working. And I know when I'd seen the briefing on this, it was particularly covering Bedwas, Machentry, Thomas area. There was a direct route to Royal Gwent and the Grange, and also not just for, it was for visiting relatives as well as those who've got a medical appointment. So again, I would like to kind of keep an eye on that and maybe follow up and receive some feedback on how that's working and whether that's something else we could roll out. But happy to follow up on that. And Nick, do you want to pick up anything in particular around the practice issues?
Yeah, I mean, I think your points are very well made around the available access, if you like, to primary care services and the challenge we've got with the smaller branch surgeries or what were independent one-man practices in a lot of cases in particular parts of the Caerphilly borough area, which, as the majority of our GPs we commission the care from them, they're independent providers, that when they hand back the contract, we need to make decisions then about whether or not we can sustain the service or indeed replace it with other independent contractors, which in many cases in the case of sort of small independent surgeries, that's not been possible. So we've had to utilise some of the bigger surgeries, whether it's Bryn Tirien in the north part of the patch and Nangarrow in the south, where they've in effect soaked up some of that, maintained some of the branch opening hours, not necessarily all of them, but it is the challenge we've got is the availability of GPs. The numbers coming through are not meeting the overall requirements, and we've got this continual roll of retirements followed by new recruits, etc. So I recognise the challenge, and what we're trying to do is protect and sustain the bigger practices so that they can provide the required service, if you like, for a wider population which might not be ideal for everybody, but it's probably the safest way in which we can progress.
Okay, thanks, Nick.
Thank you for that. Did you, Nick? Sorry, Steve, are you happy with that?
Just to come back on a couple of points there. I would be very grateful if there's any developments with transportation, if they could link in with myself or other councillors in the Penrell ward, but also in the Abertrajohn and Gennedd area as well, where we're having some extreme difficulties being raised by residents with transport. And in relation to the surgery issue, of course, this is being compounded by not only actual building, but also the local development plan, where there is, planned housing and residential developments taking place into areas that have no surgeries whatsoever. So people can't even get a registration with a doctor. So there seems to be a slight out of sync, if you like, situation there, where we're closing surgeries yet developing residential estates. So I think perhaps we could all work more closely on that one. Thank you.
Thank you for that, Councillor Skibbins. Councillor Vincent James.
Thank you, Chair, and thank you, Nicola, for your very extensive presentation. I'd just like to echo Councillor Skibbins' remarks about commending you and your colleagues through working through such such incredibly challenging circumstances over the past 2 years, as if it hasn't been challenging before. At the beginning of your presentation, you referred to civil contingency arrangements, and I just wonder if you could kind of outline what those kind of arrangements might be. And I'm taking a guess at this. You've explained about there's very little capacity within the health estate for beds. That there are extremely considerable bed pressures, and I'm wondering what work has been done around patient flow to avoid unnecessary hospital admissions in the first place, and then those people that have perhaps who have been medically optimized and ready to leave hospital. What arrangements do you have for kind of step up and step down with the local authorities? Is that how that's been explored?
Okay, thanks. So I'll bring Nick and Leanne in probably to the second part. I'll pick up the civil contingencies issue if I can. So basically, this is where we, as part of the civil contingencies and emergency planning guidance, we set up a strategic coordinating group known as the SCG. This is something we requested as a health board to set up when our numbers started rising ahead of everyone else in Wales right back in March 2020, and it's very much stood up if there's considered to be a risk to life, is usually the definition, and then you set up a terms of reference of the SCG and its scope, which is generally chaired by, we've been having that chaired by the police, the Gwent Police, and we're obviously a key partner in that, alongside Welsh Ambulance, South Wales Fire and Rescue, Natural Resources Wales, local authorities, Welsh Government, military. So it's a proper, full working together and come together to basically at a strategic level. And there's usually a number of subgroups that sit under that to look at what we need to do to respond. They're often stood up very much, if there's a significant flooding or there's other emergency situations, severe weather. We've not stood up an SCG, I think, for as long as we did during the pandemic. We then stood it back down at some point, either last year, but we stood it back up in about, remind me, Nick, about August. When did we stand it back up? Last few months, didn't we?
Because it was end of August, early September.
Yeah, we stood it back up on the basis that where that demand increase was continuing, the acuity, our workforce was significantly affected. When we started seeing the overall community case rates going up, the ambulance position we felt that there was a risk for life if we didn't get together and started working together across the system. So we then set up a tactical coordinating group that sits under the SCG, which Nick was chairing, I think, which very much looked at how we work together around some of the staffing challenges and the discharging, getting people out of hospital, because obviously that was creating the whole backlog in the system at the time for us as well. So we're still in a debate of whether or not we should stand that down as a civil contingencies group, but I think the view at the minute is the challenges across the system are so significant that the benefit of the group being together is going to be useful over the winter period, because we still believe there's a risk to life if we don't get some of these issues sorted. So that's just my update on civil contingencies. Nick, do you want to just pick up the discharge plan inside of it, and maybe Leanne can come in around what we've been doing around directing people to the right place and avoiding admission?
Yeah, sure. So I think you make a good point. So as I sort of alluded to earlier, we're at maximum capacity in terms of beds. The number of what we refer to as delayed transfers of care are around about somewhere between 250 and 275 on a daily basis. They can be for any number of reasons, and I think it would be fair to say that 60% to 70% are due to what we would term as social care issues rather than health issues. So there will be a number that are waiting for us to act, and there will be a number that are waiting for social care to act. We have tried to put in place a number of sort of alternatives. So there is a relatively small capacity available in care homes, and how can we best use that capacity? So we've developed a step closer to home pathway, which is like a bridging placement into a care home. The challenge with that has been that we really shouldn't be paying for that as a statutory body, that once somebody is ready to move on, that then becomes a responsibility of another agency, or they are self-payers, or whatever their arrangements are. And there becomes a bit of a minefield of how we step in for a period of time until we can hand a patient over to the respective home, for that to be billed, whether it be to the local authority or to that individual. So that has been quite challenging. I've been doing a lot of work through the RPB, the Regional Partnership Board, looking at alternative social care provision, but I'm sure you'll all appreciate that is extremely difficult and challenging at this point in time with the current shortfall that there is within social care. But I think the onus has got to be on us all to find some solutions. There is, if I may say, too much of a heavy reliance on hospital beds as being the safe place, that the public and others recognise that there'll always be a hospital bed, so that's quite an easy solution. And actually, we will get to the point at some point this winter, if we're not careful, where there won't be a hospital bed. And actually, that is not, in effect, the fault of the health service. That is the fault of the whole system having broken down and not being able to provide domiciliary care or care at home. So I think, we've got to all work together on this, because, it should not be reliant on the health service to provide the solution to what is a bed crisis, but is also actually a care at home crisis more than anything else.
Okay, thanks, Nick. Leanne, do you want to pick up some of the issues around appropriate presentation and?
Sure, happy to do that. Apologies from me, I've not got my cameras not functioning this evening for some reason. It's not normally what I would like, but just wanted to say in the first instance, thanks very much for your acknowledgement of the hard work and effort the teams have put in, because I think they really are feeling it, and to know that gratitude is there, it means a great deal. So thank you to both members for that. I think it's really important to hear it, and for our teams to hear it, and we'll make sure that that's conveyed. But really insightful question, Councillor James. I think in relation to sort of patient flow, probably three things I would highlight that we're working on in particular, and I'm sure that Al or Andy would be able to add into that if that's the case. The first, in terms of navigation of our system really is that as a result, because our system, I guess, is so different with the Specialist and Critical Care Centre, we've put in place a new development called the Flow Centre that allows GPs, it's the single point of access really for GPs to phone in for them to direct patients to the most appropriate setting. That's been running for now a year. It's a very new model. It doesn't exist anywhere else in Wales, but what that does do is give us the opportunity to access alternative pathways and services and systems, such as, so for example, we've got a frailty, in fact, running for Caerphilly CRT team at the moment, which is directing patients directly into frailty that would maybe historically have come into the hospital setting, and those patients can be managed much better in their home. We're not stripping them of their independence that they've managed to gain, and is a much more sort of appropriate use of resource and delivers much better patient outcomes. So the Flow Centre is really how we help, I guess, sort of some of the GPs and other healthcare professionals navigate our system. And we've been working really hard with Welsh Ambulance to tap into that resource as well, so that they aren't conveying unnecessarily and that they're accessing the appropriate pathways. The second area is, so at all of the front doors, at all of our EDs and MIUs, we have something called triage in place, where a patient is initially assessed. The acuity of that individual is, and sort of how serious that individual's condition or presentation is assessed, and then they will be routed to the right place. We hope, and the majority of times people are in the right place, but that triage process allows us to redirect them if we deem appropriate, so that only those patients requiring sort of the most acute care are receiving that. There are some difficulties with that for us. The reality is we've done some recent patient experience surveys that say that the public have really high confidence levels that ED is the right place for them, even if they believe they will have a long wait, because I guess they know that they'll get treatment there. So we do need to break down, I think, some public perception around them accessing ED for, in particular, the emergencies, particularly at the Grange. So triage is another mechanism by which we try to route people to the right place. It is difficult. I think Alistair will be able to talk more freely about this, but we do get quite a lot of patient dissatisfaction if we try to sometimes divert people to other sites. But when we do that, we do it in the interest of their patient experience and weight and appropriateness of use of resource. So there are also further developments around sort of a more consistent way of triaging using an e-triage system as well that we're hoping to bring in the next year or so. And the third and final point, and Nicola's referenced this already in the presentation, is same-day emergency care. So there's a very significant will from Welsh Government, but also from our clinical services, that lots of patients, if we could assure them that they could access an appointment, not necessarily an emergency admission, to see the appropriate clinical team, they would be able to be seen in that almost like a clinic appointment, albeit on the same day. Sometimes that can be the next day as well. They can be seen, they can have their diagnostics, and often they can be turned around or sort of diverted, or alternative methods of treatment sort of initiated, which has avoided the need for an admission. We have that running in respiratory, which is really, really important at the moment, particularly with COVID and what we would anticipate being the flu season coming, and also in gastroenterology as well, also in surgery to a certain extent, with more work to do there. But as Nicola has said, there's a big development that we have come in that means that lots more patients will be able to be treated in that way, in particular at the Grange. So lots of work going on to ensure that we're treating emergency patients in lots of different ways. And just to echo what Nick has said already, really, I feel his pain and his rubbing his head too, but hospital beds are not the main currency of healthcare delivery. I think just to echo that, there is a public confidence in the number of beds as an indicator of how well we provide our healthcare services. And that is certainly, in my belief, not the case. It's important that they're there when they absolutely need them, but we should be enabling independence and rehabilitation as soon as we possibly can. Al or Andy, is there anything more that you would want to add to the admission avoidance bit in particular?
No, I think that encapsulates it again, Leanne. I think, you know, I'm sure people have got specific questions, but I think that covers it at a reasonably high level that hopefully everybody can understand.
I think the only thing that I'd add is one, I'd like to echo Leanne's thanks. It's as a jobbing ED consultant, it's great to hear the support and the recognition of the team's work and what they've been through, and I'll pass that on. So thank you all for that. And I think the other bit is to say that, again, acutely aware that our new system is complex and that the messaging around this and how we explain it to the community is key, because I think that ED across the UK and going back many years has been a victim of its own brand, that you may wait but you will get sorted, and you know, the public have confidence in that, although they may not be happy about the wait and the conditions they wait in. They, you know, they still keep coming. And my personal bit with some of these things that we're working on around SDEC and the Flow Centre is making sure that we get the same outcomes for the patients wherever they plug into the system, because a lot of the sort of planning work that we've done has shown that it's about 30% of the patients could be managed either by an emergency department or by an urgent primary care centre or by their own GP, and we want to make sure that wherever that patient plugs in, you know, in an ideal world, we want them to plug into the most convenient one for us, but we also want to make sure that wherever they plug in, they get the same outcome, so that, you know, that we have a service that, you know, gives the best to the patients of Gwent.
Thanks, Alistair.
Thank you for that. Councillor Etheridge, you've submitted questions, haven't you? But have you got another question to ask?
Yeah, there's just 3 points. The first point is regarding the ambulance service. As you say, you know, you pick up the South Wales Argus and you see all these ambulances in a row, which is, you know, not good reading. I'm being constructive here because I think that I understand that there's weekly assurance reviews with the Chief Ambulance Services Commissioner, which actually looks at, you know, lost hours, etc., and ambulances. And I was wondering if we could do something, if an Avon Health Board could do something around positive communications, because obviously you see all these ambulances lined up, it doesn't look good. But if we're having regular meetings, which I understand we are, with the Service Commissioner, perhaps we can give some positive, you know, vibes and positive views out in a communication document, because you know, people do read them. And the other 2 quick points I've got is obviously I'm concerned about staff resources and the capacity issues. I think my residents in Blackwood, some say to me, we can't get an appointment, Kevin, with the GP, so we go to the Grange. And I say, no, this is not the way to go. You need to go to the local hospital first, in Ystrad. But I think that falls on stony ground, and they think that the Grange. So I appreciate that we've done lots of communication and marketing, but it's still not getting through, unfortunately. And my final point is, Nick, you made the point, we should all work together here. Okay, and I quote, work together. And what I want to say is, I understand that there's a review on the GP surgeries, and I asked for a copy of this review, and I was told by the acting chief exec the report was not produced for consultation purposes, but to inform how the health board could support and offer guidance to practices. If we're all working together, surely local authorities and local councillors should be informed, because that I've now filed a Freedom of Information request asking for that information.
Councillor Etheridge, I'm sure our acting chief executive will come in on that question later on.
Yeah, I'm happy to pick up that point, Chair. So, we're the only health board in Wales that has gone out to all of our general practice providers to seek from them information on the number of sessions that they're currently providing across a week. So the number of GP sessions, nurse sessions, pharmacy, etc. And we've used that information to do a bit of a peer review of the practices that we've got in order to inform us as a health board who commission the service on the levels of improvement that we require or the level of support that we can provide to individual practices. Now, the practices that, other than the managed practices, which we run as a health board, which in the Caerphilly area would be Bryn Tirion in particular, are independent practitioners, and they don't have to provide that information to us. That's something that we've asked for them to help us with so that we can help them. So there is quite a lot of information in there that we then have shared back with them as practices so that they can look at how they can compare with local practices or other practices of similar size. So it's not a question of us consulting. It's purely an information gathering exercise so that we can provide the required support to practices. So we're not trying to hide anything here. I'm very happy to have conversations with local representatives about local areas and what the services that their local practices are providing based upon the information we give them. But I don't want to share the comparative data because that puts the practice in a very difficult position, and they probably would then not share with me again that information for us to make informed decisions as we move forward. So it is, it's a document that, there's nothing hidden in it. And in the response we've given to you today, which I think runs to 5 or 6 pages, we've answered all of your questions regarding the amount of face-to-face appointments that are being provided, the level of face-to-face on a comparative basis, etc. So, that's where we are with that information. It's not a report, if you like. It's just a compilation of the data that we've gathered from our practices that they've worked with us to produce.
Thank you for that, Nick. Did you want to come in, Nicola, then, or?
So I think Nick's covered that point. Obviously, we're as Nick said, happy to work on a more local basis to kind of pick up more local issues. I'll bring Leanne in on the work that we're doing with WAST and the kind of the weekly meetings that we are now going to involve EASC with. I just want to pick up on the positive communication, because I think you're absolutely right, Councillor Etheridge. Trying to get a positive comments out there is really key. We've talked about it quite a lot in the health board, and it's quite a fine balance at the minute. I've done quite a lot of work just looking at how we compared into the rest of Wales because of the media attention we get at the Grange, and to reassure ourselves that how much of an outlier are we, and are we in the pack? What's different? Especially with the Grange being a new hospital, and it's quite clear we are clearly in the pack. We're not leading the way on urgent care like we are on some of our planned care and some of our cancer services, where we are doing really well. But we generally in the middle of the pack on urgent care. There's many services, many health boards that are worse than us in some areas. There are some that are better than us, but it's generally a very similar picture. And as I mentioned, even just seeing that we were the only health board that's seen an improved position on 1 hour, more than 1 hour handovers this October compared to last, but it's a very fine balance with the public to try to promote a positive spin when you know, it is a really challenging position, and our own experience with social media is we then generate a lot of negative comments, which is having a really negative impact on our staff. It affects our recruitment, it affects our the well-being of the teams who have worked their, you know, absolute socks off and then have to go home and read that about their own department. So it is about a fine balance, but I think you're right, it is about how we drip feed some of this positivity and work in a more tactical way with maybe the East Commissioner, and we pitch the Grange in the context of the wider pressures. You know, England has generally done much better than us on ambulance handovers, and there was pictures of Plymouth Hospital having about 30 ambulances outside the other day. So you can go at different times to different hospitals and see the similar picture. And I feel a little bit frustrated that the public think it's because we opened the Grange, not because we're in a UK national emergency. But I think your help for us as well, you know, as we work with partners in terms of conveying our messages, is really important. And I think your point about the YYF issue, I was looking because of the meeting today, just refreshing. So we get about 60 to 70 people a day still go into YYF, and I think in October 94% of those were treated and you know, admitted or sent home within 4 hours. You know, and therefore for the right treatment, it's a great service. Why would you go anywhere else if that is the right place for you to go? And we're looking at how we can improve our communication at the Grange, whether that's an electronic screen which says this is what the waits in the other hospitals and these are what you can go there for, because, you know, why wait six hours? But even I know Alistair and I were having a conversation last week when we were, I think it was high volumes of patients were in and out within 6 hours. That's after having complex diagnostics, treatment and home. You know, so it's about how we get some of that positivity out there without looking like we're trying to be defensive and then generate a whole load of negative comments, which then impacts on our teams. So working with you on how we do that would be hugely beneficial, really.
I did give a list of where the bus should go.
Okay.
You know, I actually give a list of where.
Okay, no, that's.
I had sorry, Carmen, I did have a thank you email because I said the bus should go in various, like Asda, in Bryn Mawr and Morrison's, and they said thank you very much. So I do try and be positive.
Well, thank you. And I actually went out on the bus one day, I think it was Abertillery, and you get a much better balanced feedback from the public than when you rely on the Facebook posts. You know, and there was huge enthusiasm for recruitment, people who were looking for jobs in the health board, and, you know, a very measured feedback from the public as well. So it's actually a much better means of communicating with some of the public and getting feedback. But Leanne, do you want to pick up some of the work we're doing with EASC and they are going to be a more active involvement with us?
Yeah, sure. Thanks, Nick. We've been doing a lot of work with our local ambulance sort of liaison teams, and they've been joining a meeting that we've been having, running 3 times a week. Actually, it's one of we have a whole system representation, primary and community services, Welsh ambulance, our front door services, emergency department, our operational teams, all present there, really working about what we do to improve things. And just to reinforce Nicola's point, really, there is an absolute openness and massive will from the teams to improve things further for our patients. And they keep coming back in spite of how tired and challenging it is, with lots of different ideas about how we make things better. And that joint working is really, really, really important. If you actually look at the number of ambulances that are being conveyed in particular to the Grange, recognising some of our issues and problems, since we've been doing that improvement work, that's dropped off significantly. To my mind, given a more appropriate use of the ambulance resource that we have available and ensuring that those ambulances are deployed to the people that need it most, because I think that's not always necessarily sort of been the case. So we've had that meeting running for some time. There's ongoing almost sort of continue daily sort of work on pathways with ambulance teams, in particular focusing on patient safety. If we think there's, for example, risk in the community, if the ambulances can't get back out to pick people up, then we've looked at ways in which we can send a response from the health board, for example, to ensure those patients are safe and well if there is likely to be a delay. But the issue, to be frank, is complex. It's not always related to the hospital system. And we ran an event on the weekend, actually, I think, that really shone a spotlight on how the different, we had lots of increased resource in the hospital on the weekend to really test our system, to see how it might function and to learn what else we could do to improve. And what was really, really clear is even when there were no delays and no ambulances outside of the hospital, there were still issues with demand in the community for ambulance conveyances. So lots of work for us to do. We're absolutely not resting on our laurels at all. And in a recent, the Chief Ambulance sort of Commissioner came to visit us last week, had a conversation with us last week, and will be joining our weekly meetings now going forward, just to ensure that we are doing all we can collectively in relation to sort of responding to the demands for our patient population and deploying our resource sort of most appropriately. There's lots of work, I think, just back to your point about the positive work. There's a pilot that we currently have running at the moment that we've been trialling, that there's interest on a national basis. So some of the learning we're doing and some of the scrutiny that we're given to our processes and systems and use of resource, I think could be shared across Wales and give learning and benefit to all of Wales, as well as resolving some of our local issues.
Yeah.
Thank you for that. Nicola, did you want to come back, or are you happy with what?
No, I think I'm happy with that. Yeah, thank you.
Okay. Can I just say I really, really do like the idea of the bus, because, you know, not everybody is on social media. So if there's anything that we can do within our communities, then we need to get out there and do it and work with you in making sure we promote the services. I've got one more question now from Councillor Walter Williams.
Yes, thank you, Chair. Can I say I've experienced the Grange myself firsthand with chest pains in the last fortnight. I had nothing but praise for the way they performed. Although I was sat on a chair for 12 hours, I wasn't the only one, and the waiting room is chock-a-block. But you dealt with it and everything was sorted, no problem. The paramedic, he tried to get an ambulance. In the end, I actually went in by taxi, which I didn't have to pay for. But at the end of the day, the job was done, you know. But my question would be to Nick Wood, really, because I'm councillor for the Argoed ward, where Markham Surgery is part of Binterian. And the biggest phone bill I have is about people's phone bill going to the Binterian, where sometimes they're on the phone for hours trying to get an appointment. And then they do not answer then they try again the next day. In the end, they stop and they go to the hospital themselves because they can't get an appointment to see a doctor. Sometimes it takes them 2 or 3 days to get their prescription sorted. You know, this is a big problem. Friday, for instance, a couple went up to the surgery in Markham, 12:30. They're both in their 80s. Husband had been bitten by a puppy that the granddaughter had in the house. And there was no one in the surgery who would dress that wound. They said you'd have to go down to Ystadvaux. As they don't drive, it costs them £15 in a taxi to have a wound dressed. And this is what we find in as well when people are told, oh, you've got to go to Binterian. I have a large old age population in the ward. A lot of them don't drive. So they've got to get a taxi, which is £20 to Binterian in return. The bus service only goes to Bargoed bus station, and then you've got to walk 1.5 miles up the side of a mountain. Well, if you're not fit anyway, you're not going to do that. So it's all taxi. I don't understand why you took the telephones out of Markham. Whereas patients in Markham, which we have 1,500, are now put on to Binterian where they are 14,000. So that makes nearly 16,000, all trying to get in down one telephone line type of thing. Whereas Markham would have taken that up. So I don't know what we can do about it. But that's the biggest bugbear I have, is the communication between patient and surgery.
Yeah, no, and we've obviously spoken about this before, haven't we, Councillor?
We have, yeah.
and I think we investigated a few of the phone bills that a couple of the residents from the sort of Markham area had. I mean, the issue with Markham is that our ability to sustain the service. So we've been unable to recruit into both reception posts and also nurse posts for the surgery. We've got quite a number who are long-term sick, which is why we've had to restrict the hours in the Markham branch surgery. Yeah. The transfer of the telephones was done in order to, well, we would not have been able to, we would have had one line going in and it would have been a situation where we just wouldn't have been able to man that service. So it was put alongside Bryn Tirien, where we've increased the number of lines coming in. And we've got on average about 9 or 10 people answering the telephones on every morning, which is the peak number of calls. But I do appreciate it's extremely frustrating and difficult for people sometimes to try and access when we get staff who, you know, for whatever reason are not available on that particular day. It does put that service at risk quite considerably. In terms of the transportation, I mean we have looked at, you know, what bus services are available and how that can be supportive, and you know we would work with individual patients to ensure that we can provide a service for them to be able to access the surgery. So if there are individuals in particular who are having real problems, then if I could, you know, if you could furnish me with their names, etc., then we can I can get the primary care team to have a look at how we could support them with that service. But it is I you know, totally understand the frustration, and it is something that we're trying to work through. We're trying to increase the number of lines going into Bryn Tirien. We're trying to desperately increase the number of staff that we've got, but it's just proving extremely difficult on a recruitment basis more than anything really at the minute.
Okay, thank you, Nick. Of course, there's another problem is when the health board say, oh, you can go online. A lot of the patients, they don't have
I understand
internet,
that.
you know. Okay, thanks so much.
Okay, thank you, Nick, and thank you, Councillor Williams. If you can get that information across to the health board, that would be great. I don't have any other questions, but I just wanted to say that you are all doing a remarkable job under pressures that we never thought we'd ever see. As a union official covering other health boards, I know the excessive pressures that you're all under, and I just want to thank you all. Keep doing what you do, and you always put the patients first, but always bear in mind you also need to look after your own mental health as well.
Thank you, Chair, and you know, as others have said, we really do appreciate that recognition. It does mean a lot for the teams, and yeah, we continue to think innovatively and look at ways to continue to improve in difficult circumstances. But yeah, looking after individuals and people's well-being is really important and a priority for us as well.
And no matter what grade you are.
Exactly. Yeah.
So yeah, I'll shut up there. But yeah, really appreciate you all coming along. It's coming up to 7 o'clock. You look exhausted, so we haven't got any further questions. Oh, sorry. I'm just honest. But you are doing an incredible job, and just don't forget it. You're always going to be damned if you do, damned if you don't when it comes to publicity. And you know, the media like a good story, but you know, you're all doing a fabulous job, and we're all behind you. We're right behind you. So thank you, everyone.
Thank you.
Okay, thank you.
We'll leave you to it now.
Okay, thanks all.
Bye.
Thanks everyone. Bye.
Whew, that was quite a powerful presentation there. Okay, so we're going to go on now to agenda item 8, which is the final report from the Task and Finish group on non-residential care charges. So I'd like to hand over, please, to Councillor Vincent James, the chair of the Task and Finish group, to introduce the report. Thank you.
Thank you, Chair. As you're aware, the report outlines the work of the Task and Finish group that was set up to review the charging arrangements for non-residential care that was last reviewed in the early term of the previous administration. The report summarises that Caerphilly Borough is at the lowest quartile for charging rates, at the 16th and 17th lowest charging out of 18 other councils who responded to a survey organised by Mike and Rachel and colleagues in the Social Services Finance team. In sections 3.2, it outlines the two proposed timelines for increasing charging for domiciliary care under options 1 and 2. Both options bring the council closer to a Welsh median rate by 2025-6. In section 3.3, there are 3 options that are proposed increases in relation to client contributions that propose increases of 10, 20 and 30% respectively. Option 2B takes us to the lower charge area of the median in 2026-7. Section 5 explains the background evidence gathered for the report and the composition of the working group, which included Councillor Lynn Binding until standing down in March 2021. A number of meetings were held to consider the evidence and information to inform our decision making. Section 5.14 explains the actions that were taken by officers to engage consultation with representative groups and stakeholders and the involvement of expert witnesses to assist the Task and Finish group in considering the issue. You see the effects of various options laid out in Appendix 1 and 2 as tables, and it's now before the Scrutiny Committee to consider the merits of each of the options, so it may make its recommendation to Cabinet. So
Thank you for that, Councillor James. And can I thank the Task and Finish group who've done a lot of work over the last couple of years into coming up with these recommendations. I'm going to open it now for questions. If anyone's got any questions, if you'd like to put your hands up. I can't see any. No questions? Okay. So what we'll do now is obviously following on from the recommendations are on page 21 and 22. So what I'll need now is someone to move one of the options for the hourly rate for home care.
Okay, thank you, Chair. I propose option 2 for the hourly rate.
Okay, do I have a seconder for that?
Chair, I don't know whether I'm allowed to second.
Yes, you are, Councillor James.
Right. Okay, well, then I would second that proposal.
Okay, so we've got a mover and a seconder. So what we're going to do now is the scrutiny officer will conduct a roll call because it'll be easier for us to do to gather the votes. So members, you're asked to respond with either for, against or abstain. If this vote does fail, then we'll look at the other options. Over to you, scrutiny officer.
Thank you very much, Chair. So this is for option 2 on the hourly rate. Councillor Angel. Councillor Bevan. Councillor Bazina.
4.
Councillor Bishop. Councillor Etheridge. Councillor Etheridge. Councillor Evans. Councillor Gare.
4.
Councillor Haas. Councillor James.
4.
Councillor Jeremiah.
4.
Councillor Leonard. Councillor Skivens. Councillor Thomas. And Councillor Williams.
4.
So that's been carried.
Just to come back in, I couldn't get the mic to operate. It's Councillor Skivens. It is. I'm against.
You're against. Okay. Thank you, Councillor Skivens. And so that's been carried, Chair. There's 1, 2, 3, 4, 5 votes for and 1 against.
Okay, great. So can we go now to the next vote? So can I have somebody please to move one of the options for the seasonal rate for daycare, please? Have you got a seconder?
The Chair, I'll propose option 2 again.
Okay, thank you. Okay, and have we got somebody else?
I'll second that.
Thank you, Councillor Gare. Okay, so down to the scrutiny officer again. Can you conduct a roll call, please, to gather the votes?
Yep.
Members are asked to respond with either for, against, or abstain. Thank you.
Okay, thank you, Chair. So this is for option 2 on the sessional rate for daycare, which is an annual increase of 20%. So Councillor Angel, Councillor Bevan, Councillor Bazina.
4.
Councillor Etheridge. Councillor Evans. Councillor Gare.
4.
Councillor Haas. Councillor James.
4.
Councillor Jeremiah.
4.
Councillor Leonard. Councillor Skivens.
Against.
Councillor Thomas. And Councillor Williams.
4.
Thank you, Chair. That's also been carried with 5 votes for, 1 vote against and no abstentions.
That's great. Thank you for that. Okay, so we'll go on now to item 9, which is the Gwent Regional Partnership Board Annual Report 2020 to 2021. So I'd like to hand over to Councillor Shane Cook to introduce the report, and then the author, Gareth Jenkins, who's the Acting Corporate Director, Head of Children's Services. Thank you both.
Yeah, thank you, Chair. I've got an issue with my internet connection. Can you hear me okay?
Yes, we can hear you.
Turn it on and off. I'm giving up my internet today. Evening members, you're all aware of the remit of the Regional Partnership Board and its requirements to produce an annual report. The report provides a strategic overview of the progress made with the theme strategic partnerships which make up the RPB against their agreed priorities. Recent work of the RPB is concentrated on review of the projects that are currently funded from the Intermediate Care Fund, which is known as the ICF, in preparation for the budget and revised guidance, which are being issued on the 23rd December. The RPB is aware that there will be a new funding model which will require a match funding element for schemes which could range from 10 to 50%. On the positive, the budget will be for 5 years. There's a great opportunity to plan and evaluate schemes. Details of the changes will be included in a future report to the committee. Thanks, Chair.
Thank you for that. Gareth Jenkins, would you like to come in?
Yes, thanks, Chair. I think you'll see from the report, the covering report picks up the highlights that we wanted to bring to your attention, and then the annual report is attached as an appendix, which has a tremendous amount of detail in there. So Joe and I have no intention of taking you through that, particularly not at this time of the evening. Okay. But with your permission, we would open it straight to questions.
Absolutely. Yes, thank you for that.
And between us, Joe and I will cover it off between us.
Okay, well, hopefully we won't be bombarded, but we shall see. Is there any questions from members, please, to Gareth or to Joe?
Just one from me, Chair. It's an observation. I think it's a typo on the full report. Page 7 of the report, I think we've got it on as page 45. Unless the board is extending to commons in Wales, is that a typo error? Heath?
Yes,
he's just checking to see whether we've read it.
Heath and housing?
Yes, it certainly is a typo, and we to be fair, I had already fed that back to the regional partnership team anyway. But of course, this has already been published in this form. But they've made a note of it for the electronic record. So if anyone requests the report going forward, it has been corrected.
Okay, just for brevity, you know, there's a lot of discussion on common land in Wales, and I wonder whether it's an extension of their remit.
We've got enough to do in this committee without worrying about that, I think.
Okay, thank you though, Councillor Skivins, for that. I haven't got any other hands up. We can't let them go lightly, surely. Gareth's nodding. I take it if there's no other questions, and obviously this is just to note the content of the annual report, and that's our agenda for tonight, all done. So I just want to wish everyone, sorry, did you want to come in then?
Yeah, I just say that I've got 300 questions, which I'll put into Gareth in writing at 7:30 in the morning.
I can't wait, Councillor.
As long as they're answered by 25 to 8.
And in true director style, I'll pass them straight through to Joe.
Thank you.
Delegate.
Thank you.
All right, thank you for that, Councillor Etheridge. Okay, so there are no any other agenda items for tonight. This is our last meeting now of 2021. I said that right because I was quoting 2020 earlier. So I just want to wish all officers and members a really enjoyable break over the Christmas, and see you all next year.
Nadolig Clywyn.
Good night, everyone.
Thanks, Chair.
Thank you, Chair.